Hello friends, let us now continue about intravenous urography. In the last class we have learned about the indications of intravenous urography. Now what are the risk factors of intravenous urography? So the risk factors of intravenous urography include first cardiac failure. If the patient suffers from cardiac failure, that is there is cardiac decompensation. In such conditions, one important thing is that we should not use hyperosmolar contrast, because hyperosmolar contrast, actually in cardiac failure itself there is volume overload condition. In hyperosmolar contrast, because of increased osmolarity, it draws more water in, so as a result it is not used in cardiac failure. Similarly, we should use in cardiac failure, actually we should use low osmolar contrast can be used for doing an IEPP in cardiac failure, and this low osmolar contrast is actually iohexol, can be used in conditions of cardiac failure in intravenous urography. Similarly, second risk factor is dehydration. In dehydration, especially if you see patients, especially in infants or in patients suffering from diabetes mellitus or multiple myeloma patients, in these, especially in multiple myeloma, there is Tom Hirschfeld proteins. There are Tam Hirschfeld proteins, and also benzosone proteins are present. These benzosone proteins and Tom Hirschfeld proteins, these are actually excreted in the renal tubules. So sometimes these are excreted in the renal tubules, and they can even obstruct the renal tubules also. Whenever they precipitate, these proteins precipitate in renal tubules, they obstruct the renal tubules, and whenever they obstruct the renal tubules, they will result in anuria. And finally, the renal function is completely lost because of this dehydration in multiple myeloma or in infants. Sometimes these patients, in them also there is one more thing, is it can also cause, especially in infants and in children, this dehydration. Whenever there is dehydration, this can also result in thrombosis of renal vein also. There can be thrombosis of renal vein, and as a result, because of thrombosis, there is no drainage of blood into the venous system, into the renal vein, and as a result, it can result in renal failure also. Then, in patients with diabetes with azotemia, in them, these patients are also prone to contrast mediated side effects. So in them, on using contrast, this can pose to nephrotoxicity. This can cause nephrotoxic, these contrast can be nephrotoxic, and this can also result in renal failure in these patients. So it is one of the risk factors. Then, if the patient is allergic to contrast, previous allergic reaction to contrasts also, it is a risk factor of using intravenous urogram, and it has a result in them. We should use non-ionic agents are used in them. Number one. Number two, we should also give injections of steroids are given in case of any allergic reaction. Previously, this injection of steroids is given in the present study 12 or 12 and 4 hours before giving the procedure. Before 12 or 4 hours before the procedure, we should give injection of steroids is given to these patients with allergic reaction. Then, if the patient has any history of pheochromocytoma also, we should not give intravenous pyelogram, or we should take precautions while using intravenous pyelogram, because in pheochromocytoma, whenever there is contrast, this contrast can precipitate the hypertensive crisis. Because contrast can precipitate hypertensive crisis, this is a risk factor. So, so now, what are the contrasts? Once we are done with risk factors, what are the contrasts used in intravenous urography? In intravenous urography, the contrasts can be divided into two types. One, we have non-ionic contrast media. Second, we have ionic contrast media. In non-ionic contrast media, we have iohexol, which is also called as omnipaque. Okay, in ionic contrast media, we have either iodine or we have meglumine iosalamate or diatrizoate. These are the ionic contrast media. Thank you.